Good morning, dear students. We are going to discuss soft palate today. If you just observe palate, palate forms the roof of mouth and floor of the nose. So, like the nasal surface is covered with respiratory mucosa, whereas oral surface is covered with oral mucosa. So, basically, the palate is subdivided into two parts. We have hard palate and soft palate. So, if you just observe this picture, this is the nasal cavity, this is the oral cavity. Between the nasal and oral cavity, we have hard palate. The posterior continuation of hard palate is soft palate. Now, if you just observe this oral cavity, now you are finding this is actually hard palate and this is soft palate, right? Okay. So this is the lateral wall of the nose. Here also you can see the partition bone which is separating the nasal cavity from oral cavity is hard palate. Posterior continuation is soft palate. So hard palate is forming anterior 2/3 of the palate, which is formed by two bones, palatine processes of maxillary bone, horizontal plates of palatine bone. Okay. The hard palate has been discussed when we were doing norma basalis also. You can see the hard palate is formed by the palatine process of maxilla, which contributes anterior 2/3, and in between we have intermaxillary suture. Posterior 1/3 is actually contributed by true palatine bones, which is horizontal plate of palatine bone. Between these two bones, we have interpalatine suture, and posteriorly we have posterior nasal spine. Okay, anteriorly the opening, what we have in the intermaxillary suture is incisive foramen with openings of incisive canals. Laterally on each side, you will see the greater palatine foramen and lesser palatine foramen. So this posterior end is actually giving attachment to the soft palate. Now coming to soft palate, it is a movable muscular fold suspended from the posterior border of hard palate. It separates the nasopharynx from oropharynx. Soft palate has two surfaces like anterior and posterior. Then it has two borders like superior border and inferior border. Okay, so this is the soft palate, and you can see basically when we see inside the oral cavity, you are finding the palatine tonsils also. This is tongue and this whole area is soft palate, and the downward projection coming from the soft palate is actually called as uvula. The soft palate is a fold of mucous membrane. It contains palatine aponeurosis, which is nothing but flattened tendon of tensor veli palatini muscle. Near the median plane, the aponeurosis splits to enclose musculus ovulae. This is the area of musculus ovulae. The levator veli palatini and palatopharyngeus muscles are there. Palatoglossus and numerous mucous glands we see in the structure of palate. To summarize, the muscles of soft palate are tensor palati, also called as tensor veli palatini, levator palati, also called as levator veli palatini, musculus ovulae, palatoglossus, palatopharyngeus, and we will see the details of origin, insertion, nerve supply, action in the following table which comes now. Now you can see here, now see these are the palatine muscles which we can see. So what are the muscles we are finding? Levator veli palatini, we are able to see. This is tensor veli palatini, and this is the musculus ovulae, and this green area is palatine aponeurosis. Okay, this is the palatopharyngeus muscle. So you can see exclusively like the palate muscles have been shown here, levator veli palatini, tensor veli palatini. This is the pterygoid hamulus which is shown here. Okay, this is the pterygoid hamulus. Then we have palatopharyngeus, then palatoglossus muscles, and in the flattened tendon in the middle where you have a small tongue-like projection which is nothing but musculus ovulae. So now let us see the origin and insertion of these muscles. Tensor veli palatini, let us see the muscle. So this muscle, this is the tensor veli palatini. So this muscle you are talking about, it is coming from the lateral side of the auditory tube, adjoining part of the base of the skull, greater wing of the sphenoid bone and scaphoid fossa of the sphenoid bone. Insertion, the muscle descends, converges to form a delicate tendon which winds around the pterygoid hamulus, passes through the origin of buccinator and flattens out to form palatine aponeurosis. Aponeurosis is attached to the posterior border of hard palate, inferior surface of palate behind the palatine crest. The action of tensor veli palatini is tensor, that means it tightens the soft palate, chiefly the anterior part. It opens the auditory tube to equalize the air pressure between middle ear and nasopharynx. Next muscle what we see here is this one. So that is the tensor veli palatini muscle. So now this levator veli palatini, this one. Levator veli palatini. So levator veli palatini is a cylindrical muscle that lies deep to tensor veli palatini. So it comes from the inferior aspect of auditory tube, adjoining part of the inferior surface of the petrous part of the temporal bone. Insertion, muscle enters the pharynx by passing over the upper concave margin of superior constrictor, runs downwards and medially and spreads out in the soft palate. It is inserted into the upper surface of palatine aponeurosis. Levator means it elevates the soft palate and closes the pharyngeal isthmus. It opens the auditory tube like tensor veli palatini. Musculus ovulae. In the midline, we have seen this muscle. This is musculus ovulae. So musculus ovulae, this is the longitudinal strip placed on each side of the median plane within the palatine aponeurosis. Origin, posterior nasal spine and palatine aponeurosis. Insertion, mucous membrane of uvula. Action, pulse of the uvula. Then with the tonsil, actually we have two arches. Anteriorly we have palatoglossal arch, posteriorly we have palatopharyngeal arch. In the palatoglossal arch we have palatoglossus muscle. In the palatopharyngeal arch we have palatopharyngeus muscle. You can see this is anteriorly palatoglossus, posteriorly palatopharyngeus. Okay, so we have palatoglossus muscle and palatopharyngeus muscle, okay, which is associated with the tongue is palatoglossus, the one which is associated with pharynx is palatopharyngeus. In between them, you will see palatine tonsil. So palatoglossus is taking its origin from oral surface of palatine aponeurosis. It descends in the palatoglossal arch to the side of the tongue at the junction of its oral and pharyngeal part. Palatoglossus pulls up the root of the tongue, approximates the palatoglossal arches and thus closes the oropharyngeal isthmus. Palatopharyngeus consists of two fasciculi that are separated by levator veli palatini. So origin is anterior fasciculus from posterior border of hard palate, posterior fasciculus from palatine aponeurosis, descends into the palatopharyngeal arch and spreads out to form the greater part of the longitudinal muscle coat of pharynx. It is inserted into posterior border of the lamina of thyroid cartilage, wall of pharynx and its median raphe. Action, it pulls up the wall of pharynx and shortens it during swallowing. The functions of soft palate, it isolates the mouth from oropharynx during chewing. It separates the oropharynx from nasopharynx so that food does not enter the nose. By varying the degree of closure of pharyngeal isthmus, the quality of voice can be modified and various consonants are correctly pronounced. During sneezing, the blast of air is approximately divided and directed through nasal and oral cavities without damaging the narrow nose. Okay, now you can see this is airway through the nose and this is the oral cavity and this partition is the hard palate. Further continuation would be the soft palate. Now coming to the nerve supply of the soft palate, all muscles of the soft palate except tensor veli palatini are separated by pharyngeal plexus which is formed by vagus and the accessory nerve. The tensor veli palatini is supplied by mandibular division of trigeminal nerve. General sensory nerves are derived from middle and posterior lesser palatine nerves, the glossopharyngeal nerve. Special sensory or gustatory nerves carrying taste sensation are contained in lesser palatine nerves. Secretomotor nerves are also contained in the lesser palatine nerves. Now, the blood supply of the soft palate, it comes from greater palatine branch of maxillary artery, ascending palatine branch of facial artery, palatine branch of ascending pharyngeal artery. Venous drainage goes to pterygoid and tonsillar plexus of veins. Lymphatics drain into upper deep cervical group of lymph nodes. Coming to the development of palate, we already did, and we have done the defects as well. Now, Waldeyer's lymphatic ring. So we have discussed this ring when we were doing the lymphatic drainage of head and neck. So this Waldeyer's lymphatic ring is actually formed by the nasopharyngeal tonsil. On either side of the opening of the eustachian tube, we have tubal tonsil. Inside the oral cavity, we have palatine tonsil. On the posterior aspect of the tongue, we have lingual tonsil. So nasopharyngeal tonsil, pair of tubal tonsil, pair of palatine tonsil and lingual tonsil completely forms a ring at the entry point of the oral cavity into the nasopharynx and into the larynx, continuity. So that defense mechanism which is formed by such a rich lymphatic tissue is nothing but Waldeyer's lymphatic ring. In relation to naso-oropharyngeal isthmus, there are several aggregation of lymphoid tissue that constitutes Waldeyer's lymphatic ring. Now, after that, let us discuss about the tonsil. So, where do we see the tonsil? See, inside the oral cavity, we have two tonsils, right? See, like palatine tonsils. You just observe this picture, you can see this is hard palate, this is soft palate, this is tongue, and this is oropharynx. Inside the oropharynx, we are able to see two palatine tonsils. These palatine tonsils are actually situated between the two folds. So anteriorly, the fold is palatoglossal arch, posteriorly, the fold is palatopharyngeal arch. In the palatoglossal arch, we have palatoglossus muscle. In the palatopharyngeal arch, we have palatopharyngeus muscle. Between these two arches, we have palatine tonsil. Okay. Now, even in this picture, we are able to see this is the palatine tonsil, and we are able to see the arches as well. This is the palatoglossal arch, which has been dissected to show palatoglossus muscle. Behind, we will have palatopharyngeal arch, where we have the palatopharyngeus muscle. So between the palatoglossal and palatopharyngeal arches, we will have, see, this is the palatopharyngeus, this is the palatoglossus. Between these two, we have palatine tonsil. So this is the palatine tonsil inside the oropharynx, anteriorly palatoglossal arch, posteriorly the palatopharyngeal arch. Okay, then now when you observe these palatine tonsils, the presenting parts are, it has upper pole, it has lower pole, it has anterior border, it has posterior border. Near to the midline, this surface would be medial surface. When you remove this palatine tonsil from this tonsillar fossa, the other surface will be lateral surface. I repeat, it has upper pole, lower pole, anterior border, posterior border, medial surface and lateral surface are the presenting parts. Okay. Palatine tonsil occupies the tonsillar sinus or tonsillar fossa between palatoglossal arch and palatopharyngeal arches. It can be seen through mouth inside the oropharynx. It has two surfaces, that is medial surface, lateral surface. It has two borders, anterior and posterior border. It has two poles, upper pole and the lower pole. So this would be upper pole, this would be lower pole. Front will be anterior border, behind will be the posterior border. Inside the oral cavity, the surface is medial surface. The one which is resting in the tonsillar fossa is the lateral surface. Now see, on the medial surface, it is showing so many folds which are actually called as crypts. And one crypt will be quite big, which is called as crypta magna or intratonsillar crypt. So now if the place where the tonsil is resting, this is actually called as bed of the tonsil or tonsillar bed. So the structures what you see in the tonsillar bed are palatine vein, loose areolar tissue. We also see palatopharyngeus muscle. This muscle is the superior constrictor of pharynx. We also see ascending pharyngeal artery, ascending palatine artery, tonsillar artery, and facial artery. The same thing is written here. The bed of the tonsil is formed from within outwards. Pharyngobacillar fascia, superior constrictor, palatopharyngeus muscle, buccopharyngeal fascia, styloglossus, and glossopharyngeal nerve. Now coming to the blood supply of the tonsil. The blood supply of the tonsil comes from greater palatine branch of maxillary artery, then palatine tonsillar branches coming from ascending pharyngeal, like tonsillar branches coming from facial, tonsillar branches coming from the lingual arteries. So these are the main source is tonsillar branch of facial. The additional sources are ascending palatine branch of facial, dorsal lingual branch of facial, branch of lingual, and ascending pharyngeal branch of external carotid. Lymphatic drainage, it drains into jugulodigastric node. Nerve supply of tonsil comes from glossopharyngeal and lesser palatine nerves. Tonsil development embryology develops from the endodome of the ventricular part of the second pharyngeal pouch. Now, coming to the clinical aspects, the tonsils are enlarged usually they are large in children. Usually they regress in size, retrogress in size after puberty. Enlarged and infected tonsils often require surgical removal. The inflammation of tonsils is tonsillitis, which we usually suffer. And the surgery which is done to remove the tonsils is tonsillectomy. So we should know the relationship of tonsil and the structures what we see in the tonsillar bed, so that we do not damage the nerves which are present, blood vessels which are over there. Okay. Then tonsillitis may cause referred pain in the ear, as glossopharyngeal nerve supplies both tonsils and also the ear. Thank you.